Good evening, everybody. At the outset, my sincere apologies for not being able to physically come today. Bhubaneswar is a place which I enjoy coming to. Unfortunately, I developed a meniscal tear and I have a surgery scheduled tomorrow, and it is impossible for me to travel. In the next 30 to 40 minutes, ladies and gentlemen, I am going to take you with me on a journey which I am absolutely sure every member of this audience is going to be a part of. Healthcare is going to be revolutionized with what is called artificial intelligence. The caricature which you see on the right may very well be a reality in the time of my children, not even in the time of my grandchildren. The term artificial intelligence was coined in 1956 by John McCarthy. As a clinician, I really think the term A in AI should refer to augmenting, amplifying, accelerating, and assisting in an ambient milieu. Accelerated engineering, analysis, and workflows expedites the processing of data. As clinicians, what do? We essentially process data. AI is the use of computer systems able to perform tasks that normally require human intelligence. And what do I mean by intelligence? I mean visual perception, speech recognition, decision making, and translation between languages. AI is already becoming an integral part of the healthcare delivery system, but this will happen only when its adoption results in consistently better outcomes and reduced costs. AI requires thorough and systematic evaluation prior to integration in clinical care. A disruptive technology, we should not underestimate the potential for impact of AI. Medical information gathered at the point of care will be analyzed in real time using sophisticated machine algorithms to provide real-time actionable analytics. And this is going to happen very soon. From a commercial point of view, you can expect a CAGR, a compounded annual growth rate of 40.6%, 40% in the healthcare industry. And it is predicted that in just 3 years from now, we will be reaching 40,000 Indian rupees as the annual turnover of AI in healthcare alone. Using AI to reach a patient is no longer a question of if, it's a question of how, and also it's a matter of now. AI should ideally address the problems clinicians really have, not what engineers think they have. Today, the healthcare industry is literally being taken over by technologists, engineers, and scientists. And I, for one, believe that eventually we may become, if not an endangered species, we will certainly, our job profile is going to change considerably. Only information that is needed should be supplied, and only when needed. Workflows should not be redefined. Existing workflows should be augmented, and if necessary, only new workflows to be added. Machine knowledge, what are the components of artificial intelligence? I am not going into the details of computer technology. From a clinician's point of view, what do we think should AI really consist of? Machine learning, or ML as it is called, is the basis of artificial intelligence. This is a field of computer science that gives computers the ability to learn without being explicitly programmed. This evolves from study of pattern recognition. These algorithms can learn from and make predictions on data. Deep learning is another subset of machine learning, which has networks capable of learning supervised and unsupervised from data that is unstructured or unlabeled. Natural language processing, This is something which is absolutely mind-boggling. Gone are the days when we have to input data using a keyboard. I have for the last 1.5 years at home a Google Assistant. I talk to the Google Assistant every time and it is able to recognize not only my voice but also the voices of my wife, family, and even visitors who come home. Natural language processing interprets complex variables including slang, regional dialects, and appropriate to the social context. Fuzzy logic. Fuzzy logic is similar to what a doctor thinks when he sees a patient, gets the data, analyzes the data, and interprets the data. Fuzzy logic is the basis of all clinical decision making. Clinical scenarios are not mathematics. It is not just present or absent. I always say that medicine is not black or white, it's various shades of gray. All of us experienced doctors know that symptoms can be described, are not described as never, rarely, sometimes, often, most of the times, perhaps, etc. You cannot equate this to present or not present. And each specific symptom itself can be mild, can be moderate, can be severe, can be mild in the morning, can be moderate in the afternoon, can be severe at night. How do you mathematically quantify logic? This is where fuzzy logic comes in. Data mining can be defined as the methods and processes used to perform knowledge discovery. Data mining intersects database technology, modeling techniques, statistical analysis, and finally, pattern recognition and machine learning. Now, tomorrow's 5P. I, for one, am convinced that medical care in the next decade will be 5P. What do I mean by 5P? Predictive medicine, personalized medicine, precision, participatory, and preventive medicine. When the 5P medicine is fully functional, AI will be a major component. 80% of the 41 zettabytes. What do I mean by a zettabyte? 410 trillion gigabytes of digital information currently available is unstructured. And for us to analyze this unstructured data, AI will be required. What will be the liability if an AI system makes a false decision or prediction? We are all worried about medico-legal issues. In the years to come, it will be a machine which tells a doctor what to do. Can I defend myself by saying I only followed the instructions of AI? A robot made in China scored 456 in a national level qualification test, whereas intelligent doctors got only 450. That is where AI is today. Today, there is a resistance to change. The IT industry already fears that AI will take over many jobs at present being done by programmers. Will this extend into the healthcare industry as well? Just as 100 years ago, electricity transformed industry after industry, artificial intelligence will now do the same. In the next decade, there will not be a single industry where AI is not a major component. Big data analytics will be routine. Algorithms, graphic processing units, all this artificial intelligence is used. Driverless cars, some of this are already being tested even in India. And you can see a loan application. When millions of people apply for a loan, remember that it is a bot, it is a machine, a robot, which ultimately sanctions your loan or rejects your loan. Gartner is very well known for the hype cycle which he has written about. The Gartner hype cycle for emerging technologies very clearly shows that there is an innovation trigger, there is a peak of inflated expectations. After that, maturity sets in and there is a trough of disillusionment. Finally, there is a stage of enlightenment and then comes a plateau of productivity. Right now, AI is probably in the hype cycle. In a couple of years from now, once AI is introduced into healthcare, we will have our feet on the ground and we will realize the limitations of AI. But till such time, AI is going to make the news. Medical knowledge is doubling every few years. When I qualified as a neurosurgeon, there was no CT scan, there was no MRI, there was no HIV, there was no intraoperative imaging, and so on and so forth. 90% of neurosurgery and neurology carried out today just did not exist even 40 years ago. And this will take only a few years before knowledge doubles again. Ideally, AI is suited for telemedicine deployment and privacy of patient data, integrating AI into existing workflows, EMRs, and systems. How does one leverage AI for healthcare? First and foremost, a clinician needs to educate himself or herself and her team about AI. You need to know what is AI. Partner with domain experts in health and artificial intelligence. Use AI to solve easy problems first, and only then will you gain acceptance. Focus on goals and patient outcomes. As a doctor, we are more interested in what AI can do and what it cannot do. Don't get carried away by sexy technology. View AI as a tool complementing human expertise and not as a replacement. Technology in search of an application is doomed for failure. Technology, like AI, is a means to achieve an end and not an end by itself. Now let's look at AI from various viewpoints. Let's look at the consumer. Personally, I don't like the word consumer. I'm old-fashioned. I like to think of myself as a doctor and a patient. But today we talk of healthcare provider and the healthcare consumer. Compare the cost, predictive modeling, social networking, wearables, integration of data applied real time by wearing smart shirts, by wearing smart watches, by looking at your EEG, ECG, pulse rate, blood pressure, etc., personalized activity, coaching, and so on. At the end of the day, it's all about workflow optimization. Elimination of unnecessary procedures will reduce costs, particularly in the years to come. Unfortunately, it is cost, and cost alone which will even determine what type of treatment a clinician chooses. Payers, claim processing, training and education, supply costs and management. Interoperability, security is the name of the game. It has to be secure. Network coordination, management of staff by the tens of thousands. Let's come to something which we can relate to more easily. Clinical applications. Analysis of patients' electronic health records. Today we see that a patient often goes to a doctor for second opinion in another city or sometimes in another state as well. We need to have access to all the investigations done earlier. Population health management, effectiveness of care metrics. We need evidence, we need scientific data, we need proof that one type of treatment is better than another type of treatment. Medical image processing. The day is not too far off when radiologists may not be without a job, but certainly their job profile is going to change considerably. Oncology, diagnostic assistance, we'll talk more about this later. Artificial intelligence is particularly useful in image analysis and diagnosis. All of us know that when we look at a CT scan, an MRI scan, it's a question of pattern recognition. The human occipital lobe and information processed by the frontal lobe, natural intelligence as I would like to call it, is able to recognize subtle differences in gray matter, white matter density, and based on our clinical experience, we extrapolate it and make even a pathological diagnosis. What if a computer can read these messages? Now let's look at some illustrations of clinical applications. Brain tumors cause substantial reorganization of functional systems. When I was a postgraduate and even as an assistant professor, I taught neurosurgical residents. that the broadcast area is in a particular location, the visual area, the speech area, etc., were anatomically distinct. None of us realize that this is not true. There is a reorganization of functional systems when there is an intracranial space occupying lesion. Today, machine learning techniques have resulted in automated glioma grading of MRI images with MR spectroscopy with a fantastic classification accuracy of more than 90%. Many studies have revealed that machine learning outperforms experienced neuroradiologists. Prediction models based on deep mining and machine learning algorithms using MRI and MRS have proved to be better than histopathology examination alone. There are authors who believe that in the years to come, HPE may not be required. Artificial intelligence may look at an image and achieve a sensitivity and specificity as good as what you see under the microscope. Advances in AI, science and technology of haptics is improving learning of clinical skills and procedures. In the years to come, it's going to be more and more difficult for a resident to practice, if you want to call it that way, operate on somebody in a corporate hospital, in a private hospital, in a trust hospital, and so on. And hence, learning is going to be more to simulation, where a resident will be able to simulate, or a resident will be able to learn what he would normally have learned with a real live human being. Artificial neural networks have proved superior to logistic regression models in predicting occurrence of chronic subdural hematoma, recurrence of chronic subdural hematoma, brain death prediction, intracranial pressure trends, and even choice of stimulation with DBS, deep brain stimulation, and even medication therapies for Parkinson's diseases. Hundreds of papers in peer-reviewed index journals now talk about the use of AI in various neurological applications. In a prospective trial of 150 patients scheduled for low back surgery, AI outperformed clinicians in predicting likely operative findings. Based on the MRI images, the clinical history, the examination, AI said you will have a hypertrophied ligamentum flavum, you will have an isolated facet stenosis, you will have a mild HNP, and so on, and they outperformed clinicians who have spent an entire lifetime operating on low back patients. Artificial neural network significantly outperformed regression models and clinicians on multiple performance measures in predicting outcome following head injury. Now let's look at a few photographs. Just look at this, prostate cancer. Now in prostate cancer, an AI model from Stanford University trained on a database of 130,000 images of skin lesions. This refers not to prostate cancer, representing 2,000 different diseases. AI achieved an accuracy matching the diagnostic accuracy of 21 dermatologists. A machine picked up and diagnosed a malignant melanoma and differentiated it from a benign condition. Again, deep learning algorithms today have been used to detect lymph node metastasis in women with breast cancer. The day is not far off when AI will be used by a pathologist more and more. Now let's look at ophthalmology. Diabetic retinopathy, the fastest cause of blindness. And I'm very happy that I am personally involved in a major tele-ophthalmology study, 115 centers in Andhra Pradesh, in rural Andhra Pradesh. We have already completed more than 28,000 fundus images have been examined, and diabetic retinopathy are being diagnosed remotely by 60 ophthalmologists. In the next couple of years, we hope to be part of this program, and I'm sure in my lifetime, I will be able to use a software program which will be able to diagnose diabetic retinopathy in rural India. This is the world we are living in. Similarly, there are many clinical applications. Let's take radiology. Filtering incoming images based on priority using the deep learning. All over the world, a radiologist has at least 10, 15, 20, 30 images waiting in queue for him to read and interpret it. Just imagine if the machine is able to make a preliminary diagnosis, recognizes a hemorrhage in the brain, recognizes an infarct in the brain, recognizes hydrocephalus in the brain, and pushes up this from position number 28 to position number 1 and 2, so that the normal CTs and MRI are read by the radiologist much later. Again, occasionally the radiologist says the quality of the pictures is not good, movement artifact, and so on and so forth. Imagine if a machine can qualify image quality control, can do an imaging triage, efficient image creation, computer-aided detection, and automatic report drafting. Today, semi-automated reporting is already done. Most radiologists in even secondary and tertiary care hospitals in India have predetermined computer-generated reports, and most of these are not even signed by the radiologist. Today we have computer vision programs which will dramatically improve the productivity of radiologists, as they have been trained on tens of thousands of 3D images. Here is a practical clinical example. Just look at this. 1 million hospitalizations and 50,000 deaths per year in the United States alone from pneumonia. 2/3 of the world population do not have access to trained radiologists for diagnosis. And here you see a picture where a machine is able to pick up probability of pneumonia in the indicated areas, which is missed on a plain black and white chest X-ray, even when read by competent pulmonologists. Stethoscopes of the future. I belong to the BC era. Before computers and before Christ are one and the same. The Lancet had an article which was called Obituary of the Stethoscope. In the future, this will be the modern stethoscope, a single diaphragm bell which a patient can place on his chest wall himself, Bluetooth enabled, and on your smartphone. The program has been loaded, app has been loaded, and on your smartphone you not only will be able to see a graphic representation of a mid-systolic murmur, a mid-diastolic murmur, a third heart sound, a fourth heart sound, etc. But more important, it will even give you a probable diagnosis. And instead of doing a formal echocardiogram, very soon it is expected that the physiological function of the valves, whether you have an incompetent mitral valve or an incompetent tricuspid valve, all this will be seen on your phone application using a simple device. This, ladies and gentlemen, is not the future, it is a present. Next week, there will be an article in Neurology India called Artificial Intelligence in Neurosciences, a clinician's perspective. This article will describe in great detail with references how neurology and neurosurgery must start accepting artificial intelligence. Google is no longer an IT company. In my lifetime, I'm absolutely certain that Google, IBM, Sun Microsoft, and all the big IT companies are going to enter healthcare in a big way. Uberization of healthcare is the term used. Google is training machines to predict when exactly a patient will die. Brain passwords may unlock future phones. All of us go through the era where we forget passwords. I don't remember what password I gave for what. And in the future, your detection of electrical activity of groups of neurons in the brain will become so sophisticated that all you have to do is to wear a headband, and this will telemetrically record electrical activity, and that will be used as a password to unlock your computer. This is an example of artificial intelligence. In case many of you think that I am living in a world of my own, if you think that this is pure science fiction, that this is not going to happen in India, Bhubaneswar, for example, all of you are wrong. Absolutely certainly, Odisha will very soon have artificial intelligence. If what Niti Aayog wants to do, Niti Aayog has already created a full section and department for use of artificial intelligence in many states in India, and healthcare is also one of the areas which it has identified. Google's artificial intelligence computer is no longer constrained by the limits of human knowledge. Today, a computer can beat the world champion either in a chess game or any other game. Using digital tools is not a question of if, it's a question of how, and it's a question of now. What do these advanced technologies really consist of? They include specifically analytics, artificial intelligence, business intelligence, cognitive computing, predictive analytics, and so on. I am very concerned that tomorrow's doctor will be so engrossed in all these automated mechanisms. As you can see on the cartoon on the right, he would not even have examined the patient, but he would be worried about the cholesterol and the triglyceride values. A few weeks ago, I was in Taipei and I had the pleasure of walking with this robot you see on the right. It was amazing. 15 minutes I spent to the robot, and honestly, I thought it's difficult to distinguish this from a human being. This is what is going to happen in the real world. Google today can predict the risk of a heart attack by analyzing fundus pictures. Half of chief information officers in corporate hospitals have said that they are planning to deploy AI in the next couple of years. And this is what is going to happen. You can see here electronic health records. AI will be using EHRs as smart analytic tools. And again, FDA, one of the most stringent organizations in the world, has recently approved an M-Health app. Now, what do I mean by an M-Health app? No human intervention at all. And information is given to an application giving the age, sex of the individual, the clinical condition, the CT images are given, and this app takes a decision, a support tool to decide whether thrombolysis is to be initiated or not. Of course, it has to be finally confirmed by a human being, but nevertheless, this is expected to considerably reduce the time taken for a decision to be taken by an expert. Oncology, we are all aware of cancer diseases, an epidemic as it were. India today has in Karnataka, Manipal Hospital, and recently the Apollo hospitals both in Chennai, Hyderabad and Delhi have subscribed to IBM Watson, and artificial intelligence is already been started being used for almost every single cancer patient who comes to one of these quaternary care centers, where real-time data, real-time changes to take place are used for that particular patient who is being treated. Palliative care can be improved with deep learning. We are all aware of Cochrane, and the Cochrane technology also is using artificial intelligence. So, ladies and gentlemen, healthcare is going to be totally different. It will no longer be the AIMS, the Apollos, the Trinity hospitals, and the various other hospitals. It will be Microsoft, Google, Sun Microsystems, IBM, which are going to enter into the healthcare in a big way. Microsoft Intelligent Network for Eye Care is a major project which has just been started in India. Now let's look at a few practical examples. Customer data is increasingly being used to predictive health. Now let's say I stop in a mall and I want to buy some ice cream. And even as I'm looking at the ice cream, there's a CCTV which looks at me, facial recognition, plots me with my Aadhaar card, knows that this is K.Ganapathy, who's already obese, diabetic, hypertensive, etc., etc. And I get a message on my smartphone, hey, look, your last cholesterol and triglycerides was high. Do not buy this particular ice cream. Instead, go to 5 shops to the left, 2 shops to the right. You will find fresh vegetables there. This is not science fiction. This is already happening. And why do you think this is happening? This is happening because health insurance companies are interested in their ROI, return on investment. They do not want to reimburse money for a carotid endarterectomy, for a coronary bypass surgery, which could have been prevented if only my sugar, cholesterol and triglycerides had been controlled. So these are just some examples of where artificial intelligence is going to be used. Apollo Hospitals has already partnered with Google, and in the next few years, I think we will be seeing Indianized data, using Indian data, how to use artificial intelligence for detection of cardiac diseases and so on. This was a slide which I picked up from the internet a couple of months ago. 826 companies, each of which has got at least $20 to $50 million as an annual investment, dealing exclusively with artificial intelligence in healthcare. So to conclude, I would like to say what Charles Dickens said: it is the best of times, it is the worst of times, it is the age of wisdom, it is the age of foolishness, it is the spring of hope, it is the winter of despair. We had everything before us, we had nothing before us. I wonder sometimes if Charles Dickens could have been referring to artificial intelligence and natural intelligence. Good and evil, ladies and gentlemen, are two sides of the same coin. In the natural intelligence era, white hair, like I have, was considered essential for experience, judgment, problem-solving skills, using rudimentary tools and limited resources. In the AI era, age is irrelevant as data interpretation is a function of algorithms. As early as 15 years ago, I remember Dr. Pratap Reddy, chairman of Apollo Hospitals, once asking me, do you have any young neurosurgeons? We are looking for specialists. I want somebody between the ages of 30 and 35. This is the future. You need not become 65 and 70 years old to get all these skills. Today, with artificial intelligence properly applied, a person much younger than this will be able to develop knowledge. But whether he will develop the wisdom which white hair can give, I do not know. Again, I hope in my lifetime, we will see the use of medical drones where a considerable amount of artificial intelligence is used, and drones may be used not only to transmit medical products, blood and things, but also eventually to transport organs for organ transport. By 2020, which is just 2 years from now, health apps will be the first choice for seeking information about healthcare. The dominant players in the healthcare business will not be the AIIMS and the Apollos and the Gangaram hospitals. It will be the Googles, the Microsofts, Apple and Uber. Patients will use a digital symptom checker based on AI that will be more precise than the diagnosis by a doctor. Patients will have access to digital laboratory tests based on nanotechnology that will allow lab self-test on capillary blood at home. POCD, point of care diagnostics. We use this to carry 22 tests in the remote areas of the Himalayas and in villages in Andhra Pradesh and other states. The smartphone will be a self-diagnostic tool and will include a stethoscope, an ophthalmoscope, an otoscope, a dermatoscope, ECG and ultrasound. We will have the first e-health lawsuit because a computer killed a patient in the absence of a doctor. Medical drones, who knows, in the next 2 to 3 years, you may find medical drones flying about the country. Finally, ladies and gentlemen, I would like to conclude in a philosophical note. The good physician treats the disease. The great physician treats the patient with the disease. Medicine is a science of uncertainty and an art of probability. Listen, listen, listen. The patient is telling you the diagnosis. This was what Sir William Osler said 120 years ago. I wonder how we would have reacted to the introduction of AI in healthcare. For centuries, the essence of practicing medicine has been a physician obtaining as much data about the patient's health or disease as possible and taking decisions. So what is my final take-home message? Good and evil are two sides of the same coin. Time alone will tell if AI in healthcare will be a bane or a boon. To the clinician, artificial intelligence will be adopted as an integral part of his or her armamentarium only when there is incontrovertible evidence that AI betters outcomes and reduces cost. We, ladies and gentlemen, are in a stage of transition. All transitions offer great opportunities. AI will never, should never replace a commiserating clinician. Hopefully, the AI-enabled clinician will now spend more time empathizing with his patient rather than getting drowned in voluminous data. This is the India of today. As you have rightly guessed, the two babies on the top One on the left is preparing for the IIT entrance examination, and the baby on the right is preparing for the NEET examination. The slides at the bottom are slides taken from a district in Kerala, the world's first district recognized by the United Nations with 100% computer literacy. This is the era in which we are living now, and I, for one, am absolutely certain that from a third world developing country and such terms, we will very soon become, if not a superpower, we will certainly be near the top. India no longer follows the West. India no longer piggybacks. India no longer leapfrogs. After all, how much from a frog leap? We pole vault. And the deployment of artificial intelligence in healthcare is one such area where India can show its lead. The government has already announced that 5G we would be one of the first in the world to use 5G, and I hope that artificial intelligence will eventually be an excellent tool in the armamentarium of the clinician. Thank you once again, and my sincere apologies for not being able to be there physically. It was Nathaniel Hawthorne who once remarked, "Where the mind and the heart is, there is your true existence." And ladies and gentlemen, believe me, though I am physically at the Apollo Hospital, Chennai, my mind and heart is in Bhubaneswar, and I look forward to an opportunity to visit the Trinity Hospital soon. Thank you.